Hey everybody, this is Nick Sheward. I'm here with Jan Diana and George Barroso, and today we're going to be talking about HIPAA compliance for development and test data. How you doing today, George?
Good. How are you?
Not too bad. Thanks for coming in.
Thanks for having me.
Yeah, absolutely. Glad you can make it. So tell us a little bit about yourself. As far as development and test data, how does that play into your daily life? How long have you been in this industry?
So I've been dealing with development and test data for well over 10 years. We handle, de-identification, masking, redaction, whatever some folks call it, obfuscation. But essentially, we've been doing that for our clients for 15 years or so, specifically around HIPAA and healthcare. We've been doing that for clients since 10 plus years now. And then was our first healthcare client. So you could say we have a lot of experience in helping them make sure that they have HIPAA compliant data in the development and test environments.
Very cool. Very cool. Obfuscation, by the way, that's a new word for me. I got to write that down.
Oh yeah, there's all sorts. They come up with one every new.
Yeah, they do. Yeah, we were just talking yesterday about interoperability. It's like, okay, synergy would work pretty well too. But
that's right.
Another thing you mentioned was HIPAA. What exactly is HIPAA? Why is it important to software developers?
So HIPAA stands for the Health Insurance Portability and Accountability Act. It's basically a law that protects patients' medical data, or protected health information. That's abbreviated as PHI. So you hear a lot of people talk about PHI. That stands for protected health information.
Okay.
And it's very important because if you're doing development, there are very strict regulations and kind of rules about how you handle the data, who's supposed to have access to the data because it's protected.
Right.
And so if you're, a developer at a healthcare firm or, some company that's dealing with healthcare data, you do have to be very careful about how you handle that data because if it's not de-identified or, masked, obfuscated, however you want to refer to it, if it's actual data, then there are very strict rules about who's supposed to see it and how you handle it.
Right.
So that's why it's important to consider because if you violate those, then you have legal and financial issues.
And nobody wants those.
Nobody wants those.
Not in this day and age.
Of course. To follow up with that, of course, what risks are associated with using real PHI in development environments?
Well, so, in production, you always have, everything's very locked down. And so you're going to have your real health information in those systems. But when you get to development and testing, they're not going to put the same controls around those systems, and many more people are going to have access to it.